Hello, my name is Dr. Armodius Hatzidakis. I'm a fellowship-trained orthopedic surgeon at Western-Orthopedics, and I specialize in treating conditions and injuries of the shoulder and elbow. In this video, I will be discussing the anatomy of the shoulder. The shoulder is an amazing complex of articulations, or joints, that show the most range of motion of any moving part of the body. The bones of the shoulder include the scapula, or shoulder blade, clavicle, or collarbone, and the humerus, or arm bone. The scapula is the anchoring structure for the muscles of the rotator cuff, shown in red here. The scapula narrows at the shoulder joint to form the socket of the shoulder, which is here. This is called the glenoid. The glenoid surface is shallow and small, forming more of a saucer than a socket. The rotator cuff muscles coalesce to form the tendons, which attach to the ball of the humerus, or arm bone. These tendons form a mobile socket that keeps the ball centered on the glenoid with movement of the shoulder. This structure is unique to the shoulder and is the reason why it has the most range of motion of any joint in the human body. Lifting the arm requires rotation of the humeral ball on the glenoid, which is accomplished by contracting the rotator cuff muscles. At the same time, the scapula rotates on the chest wall, and the strong supporting muscles of the shoulder, not shown here, but the muscles you see when you look at your shoulder, add power to the motion. To keep the shoulder stable through this motion, there's an inner lining, or capsule, that attaches the ball to the saucer. This lining is normally loose when the shoulder is at rest, but tightens when the arm is taken through the extremes of motion. The anatomy of the shoulder is essential to provide its amazing range of motion. Without its complex structure, simple motions, such as reaching for something on a shelf or reaching behind the back, would not be possible. The shoulder provides the arm stability that is necessary for everyday activities, such as writing or eating. The shoulder muscles also allow complicated tasks, such as a tennis serve or swinging a golf club. When one or several anatomic structures of the shoulder are torn, broken, or compromised, a multitude of shoulder and upper extremity problems can occur. The different types of injuries or problems that can occur in the shoulder are fractures, separations, dislocations, adhesive capsulitis, rotator cuff tears, and arthritis. Let's go over them briefly, one by one. First, an injury can cause a fracture or break of one of the bones of the shoulder. The most common bones fractured are the clavicle, or collarbone, and proximal humerus, the upper part of the arm bone. Some of these fractures can be treated conservatively with an arm sling, but some require surgery to give the best chance of achieving the best possible comfort and function. Seeing a shoulder specialist early after the injury is important in order to go over these options. The second type of injury to the shoulder is a separation. This occurs at the junction of the clavicle and the acromion process of the scapula, which is here. This is called the acromioclavicular joint, and it helps form the roof of the shoulder, or the hard top of the shoulder that you can feel. A hard injury to the shoulder can cause the ligaments at this joint to tear. The ligaments are shown here. As a result, the clavicle appears to pop up, and the rest of the arm droops away from it. Usually, more minor separations can be treated conservatively and do well without surgery. More severe injuries can be treated by reconstructing the torn ligaments and stabilizing the joint. The third common problem with shoulders is instability. An injury can cause the main ball and saucer joint of the shoulder to dislocate. The most common direction is anterior, with the ball of the humerus dislocating in front and below the socket. So, this is the humerus on the glenoid. In an anterior dislocation, the shoulder comes out of the front of the shoulder, of the socket, and it usually goes downward and forward, like this. A less common dislocation, but equally bothersome, is the posterior type, where the ball dislocates to the back of the socket. Sometimes the shoulder is very loose and goes out in multiple directions. Occasionally, dislocations are associated with rotator cuff tears. Often, surgery is required to repair the torn capsule or torn capsular attachment to the glenoid, which is called the labrum. The opposite of instability is adhesive capsulitis, or frozen shoulder. This is a somewhat common condition that occurs when the capsule of the shoulder becomes tight and thick, usually for unknown reasons. Frozen shoulder is more common in diabetics and patients with thyroid problems. Usually, conservative treatment with a gentle stretching program, light pain medication and anti-inflammatories, and occasional cortisone injections can help speed up improvement with this condition. Rarely, surgery is required to manipulate the shoulder's motion back to normal or to surgically release the tight tissue arthroscopically. The fifth common problem with shoulders is rotator cuff disease. The rotator cuff, as we've discussed earlier, is the critical set of muscles and tendons that are required to power the shoulder. Rotator cuff disease can range from simple irritation, tendinitis, and impingement to small and intermediate-sized repairable tears, to extensive tears that sometimes cannot be fixed. One of the two biceps tendons in the shoulder, the long head, is located close to the most common location of rotator cuff tears, the supraspinatus insertion. As a result, sometimes the long head of biceps is involved with a rotator cuff tear and requires treatment. Please watch the video devoted to the rotator cuff to learn more. A final problem with shoulders is arthritis. When the word arthritis is mentioned, most people think of pain in a joint from getting old. To an orthopedic surgeon, arthritis is a very specific term. It refers to loss of cartilage. Our joints, including our shoulders, require moving surfaces that glide without friction. It is the cartilage and the joint fluid in our joints that give that smooth motion. When a joint becomes arthritic, this cartilage is lost, and we start to get bone-on-bone grinding and pain. This usually progresses over time and can cause significant pain, stiffness, and disability. Joint replacements of the hip and knee are well-known treatments for arthritic pain of these joints. Joint replacement of the shoulder used to be behind that of the knee and hip. Modern shoulder replacement, however, is just as effective as hip and knee replacement. The key has been that prosthetic device companies have developed a larger range of more anatomic implants, and the surgical technique of replacement has improved. New total shoulder replacements have structure that mimics the natural anatomy of the shoulder. Old implants did not have this structure. They were too large or too small for the native anatomy. Now we have the sizes we need to reconstruct the shoulder so that the shoulder looks like a shoulder again. This is key to getting the proper rotation and proper tensioning to the capsule and rotator cuff. A shoulder replacement consists of replacing the ball with a short stem that goes in the bone, and a small amount of bone is removed from the ball. The bad ball is removed, and a new ball is placed, which is made out of metal. It's very smooth and provides a very nice surface for rotation with the new socket. As we discussed in the anatomy section, the socket of the shoulder is very shallow. It's not really a socket, it's more like a saucer. So what we do to replace that surface is we simply ream or smooth the native socket, the arthritic socket. We remove some of the arthritic bone, but not a lot, just enough to get a perfect surface. And then we place a high-grade plastic component that has a curvature similar to the native glenoid or native socket. When this is done correctly, the shoulder rotates properly again. And now there's no bone on bone. The bone on bone pain is gone. The surface is now metal on plastic, just as it is with hip and knee replacements. The anatomy is good, and we can get dependable results that result in improvement in pain relief and function of the shoulder. The symptoms vary according to the specific problem in the shoulder. Instability, pain, and limited function are often signs of these conditions. If your shoulder is not functioning normally, it's very helpful to see a shoulder specialist to accurately diagnose the cause. The most important prevention strategies are to maintain the flexibility and strength of your shoulders. It's really important that weekend warriors progress their fitness programs gradually so they do not overtax and injure the shoulders with over-aggressive strengthening exercises. Advice and exercises from a physical therapist or certified athletic trainer can help. Understanding the anatomy of the shoulder can help you understand why your shoulder is not functioning the way it should. It's easy to misdiagnose the condition, so it can really help you to be evaluated by a knowledgeable professional. To learn more about shoulder anatomy, please visit our website at www.western-ortho.com. Thank you.